Why do COPD patients feel breathless even at rest? Imagine trying to breathe through a straw that keeps narrowing. That's similar to what many people with chronic obstructive pulmonary disease experience even when they are just sitting still. COPD damages the lungs in a way that makes airflow difficult. The tiny air sacs where oxygen enters the blood, called alveoli, get destroyed or lose their elasticity. This means air can get in but not fully exit when you breathe out. The trapped air causes the lungs to expand more than normal, a condition called lung hyperinflation. When the lungs stay inflated, the muscles that help you breathe have to work harder. This extra effort makes breathing feel heavy and tiring, even without any activity. It's like trying to breathe through a partially blocked pipe. Another reason is that COPD causes narrowing and inflammation of the airways. These changes make it harder for air to flow freely in and out. As a result, less oxygen reaches the blood, and the body tries to compensate by increasing the breathing rate. This increased effort adds to the feeling of shortness of breath at rest. The disease also causes a mismatch between air reaching the lungs and blood flow in the lungs, called ventilation-perfusion mismatch. This means oxygen doesn't get into the blood efficiently, leading to lower oxygen levels. The body responds by making you breathe faster and harder, which can make you feel breathless even when you are not moving. In addition, small airway disease and emphysema, a form of COPD, cause air to stay trapped longer. Each breath takes more effort because more air remains in the lungs after exhaling. Over time, this dynamic hyperinflation makes breathing increasingly difficult. The muscles involved in breathing can weaken from overuse or fatigue. When muscles are tired, they don't work as well, which makes breathing even more uncomfortable. Rapid, shallow breaths become common, reducing the effectiveness of each breath and increasing the sensation of shortness of breath. So, in simple terms, COPD causes damage that limits airflow, traps air in the lungs, and reduces oxygen exchange. These changes make breathing harder, even when you are resting. Managing these symptoms involves treatments that help open the airways, reduce inflammation, and support your breathing muscles. Understanding these factors helps explain why COPD patients often feel breathless without any activity happening.